Are my chances of developing cavities or gum disease higher during pregnancy?
Absolutely. You got so much of hormonal flow during pregnancy, and it increases, your risk like anything else because of the hormonal changes and affecting your gum health and in your oral health. We call something, what we call it as a pregnancy gingivitis, because you have increased estrogen and increased progesterone and all of these, the pregnancy hormones. It makes your gums kind of really sensitive, swollen, and it more prone to bleeding. And then your cavity risk increases because of your morning sickness, and then you end up throwing all the time, and it brings the acid inside your mouth and acid reflux. And then you're eating all the time for you or your baby. You're hungry, a lot of sugar intake and frequency of snacking exposure increases your exposure to acid more, and then sugar, and that puts you at risk for cavities. So your gum disease risk goes high, and your cavity risk goes high. And sometimes people end up having a tendency to skip your dentist, and I do not recommend you skip your dentist even though you're pregnant, irrespective of your wherever you are. Maybe on the first couple of weeks, and when you become pregnant, you can avoid the dentist. But as soon as you become pregnant, make sure that you are going to get your cleaning done. And one most common thing people do not know is, in addition to these risk of cavities and gum disease, the gum disease risk carries into your baby also. It causes a lot of pregnancy issues. It causes premature babies. It causes preterm labor, low birth weight, which are one of the most common things that people do not know. So make sure that it is not only the dental risk or the gum risk, but also you're causing a lot of risk for your pregnancy also.